the general pros and cons of birth control because there's a lot of different information out there, I would say.
Yes. So, and we're talking about birth control pills. So
Yes.
those are a pill that you take every single day. Let's talk about the cons first. First of all, you have to take a pill every day at the same time of day. If you don't, then it increases the failure rate.
Yeah.
Some people will get nauseated from it. There is an increased risk of blood clots. Now, what is that increased risk?
1 in every 3,000 women.
So 1 in 3,000 is low, not nothing, but low.
Kind of.
Yeah. A lot of times the women who do get blood clots in their legs and lungs while they're on birth control also have a genetic disorder, something called like factor V Leiden that puts them at higher risk. So if you have a family history, maybe something to get checked out beforehand. Other risks, certainly it can increase your risk of things like stroke. Now this is higher in people who are smokers and are taking birth control pills, or people who have like what we call migraines with aura, where they get visual disturbances with their headaches. So those are the cons, sort of some of the downsides of birth control pills.
Severe side effects.
Yeah, obviously the severe ones are rare, but really bad.
Yeah.
Let's talk about the benefits of birth control pills.
And weight loss. And weight gain. Too.
Weight gain. Yeah, so let's talk about that.
Sometimes,
Some people will gain weight with birth control pills.
Or lose.
Now, the studies have shown that pills that are both estrogen and progesterone, which is the majority of pills, some people will gain and some people will lose, and the average person stays about the same. With progesterone-only pills, there's a higher percentage of people who will gain some weight. Typically, it's, in the 10-pound range, but a lot of people are very concerned. They don't want to gain weight, and that is a big con for them. Ready to talk about pros? Mm-hmm. Okay, so let's talk about pros. Number one benefit from birth control pills is...
Birth control? 99% if you use it 100% effectively. So that means you have to take it at the same time, same time,
every single day.
Can't
you never miss a pill.
Yeah.
So when we look at failure rates with birth control, we usually talk about perfect use and typical use, because most of us are not perfect. And so perfect use is about 99%. Typical use is closer to 91 to 93%. So that does mean effectiveness. So it is not perfect, but it is very effective. And so it reduces unwanted pregnancies. So that is a big plus. Let's talk about some other pluses that you may not know about.
Helps with your acne.
Sometimes. A lot of people use it for that. It helps regulate your cycles. It helps make your periods lighter. Mm-hmm. And for people who have very irregular cycles or people with polycystic ovary syndrome that are not ovulating, it gives them the progesterone that they need to really support and protect their uterine lining so that they're having a regular shed every single month. Also, it can be very helpful for people who have things like endometriosis in terms of reducing the amount of pain and the amount of bleeding that they have. So I think that it's obviously a very individualized decision.
To talk with your doctor about?
Yeah, so talk to your medical provider because, are you using it for only birth control pill? Only for birth control, trying to prevent pregnancy and nothing else? Or are you using it because you have horrible cramps with your periods? I mean, that is a reason in of itself to use a birth control pill. So I think it's a very individualized decision that it's important to both weigh pros and cons, but typically benefits outweigh risks.